Hi, Mrs. Ballenger. I'm Dr. Earnshaw, Lori Earnshaw. I'm the palliative care physician.
Hello, doctor.
I'm here today to see how we can help with your pain management and talk about anything that's making you uncomfortable or worrying you in any way.
Okay.
I work as part of a team, and so you may see other members of the team, social worker, chaplain, and they all work with me. And
Okay.
But for now, I want to work on getting your pain under control.
I've never felt pain like this.
Okay.
This pain has kept me from moving, and it's kind of scary.
Okay. How long have you had the pain?
For about 2 weeks now.
Okay. And has it been pretty much staying constant, the same sort of level, or has it been getting worse?
Well, I guess it's been steadily getting worse.
Okay.
I first felt it as a lower pain in my back, and I was still walking and doing some things around the house, but then the pain got so bad I couldn't do that.
Oh gosh, okay.
And I felt very weak, and that was just really scary for me.
So how bad would you say your pain is right now on a scale of 0 to 10? 0 being no pain, 10 being the worst pain you could ever imagine.
I'd say it's about an 8.
Oh wow, okay, all right. Have you received anything since you've been here in the hospital, or did you just get here?
Well, I had the Lortab.
Okay, okay.
And that helps for a little while, and I can get some sleep, maybe an hour after I take the Lortab.
Okay.
But then the pain comes back.
Oh gosh. When was your last Lortab?
I don't remember.
Okay, okay. And you haven't gotten anything since you've been here in the hospital yet?
No, well, they gave me Motrin, I think, maybe.
Okay, okay. Or morphine?
No.
Okay, Motrin.
Yeah.
Okay, okay.
That helped, but it just upset my stomach.
Okay, all right. What about your pain? Where exactly is it located? You said in your back?
My lower back.
Your lower back. Okay. Does the pain stay in that location, or does it go anywhere?
It's pretty much there.
Okay.
But it hurts to walk. It hurts to move.
Oh gosh.
And any part of me.
Okay.
The nurses come in and she's helped me move a little bit. But it's excruciatingly painful.
Okay, okay. And I want to get you something to help your pain as soon as possible, but I just need to know a few more things,
Okay.
if that's okay.
Sure.
So you said that Motrin maybe made the pain a little bit better, but it upsets your stomach.
Yes.
Is there anything else that makes your pain better or makes it worse other than movement?
Well, before I came into the hospital, I tried cold packs. They didn't help. I even tried getting a massage, but when I came home, I was in more pain after that.
Okay, okay. And have you taken anything other than the Lortab and Motrin for your pain?
No, I don't think I have.
Okay, and other than those, the massage and the ice packs and cold packs.
Right.
Have you ever had pain before in the past, and what have you done for that pain?
I've had a tooth pulled.
Okay.
That kind of pain. I remember the dentist gave me, it began with a P.
Percocet?
Yes.
Maybe? Okay.
Percocet.
Okay.
That worked for that kind of pain.
Okay.
I don't know if that's the same kind of thing you would give me now or not.
Yeah, probably something in that family. And did you
Okay.
have any problems with
No.
that medication?
No.
Okay, okay. Do you have any liver or kidney problems that you know of?
No, I don't think I do.
Okay, good, good. I also wanted to know if you've ever had any problems with addiction.
No.
If you ever had any problems with alcohol or
No.
tobacco
No.
or anything like that.
I don't smoke.
Okay.
I don't drink because of the other medications, that I've been taking. And I just take what's prescribed for me.
Okay, okay. You said that you've not been able to walk very much, and you've had so much pain on movement. I wondered how the pain's affected other parts of your life, how it's affecting like your mood, your appetite, sleep, those sorts of things.
Well, like I said, I haven't been able to sleep much past the little bit after the Lortab, and I guess, I don't know, I guess it just wears off or something.
Might not be strong enough.
Yeah. The appetite, not so good. It's both, I don't feel like eating, and I don't feel like getting up and trying to make something for me, myself.
Okay. Oh gosh, okay.
I did go to the grocery store in the past couple weeks, but
okay.
I never finished my list. I had to come home.
Okay. So when was the last time you had a good night's sleep?
It must have been maybe 2-3 weeks ago.
Okay. And part of the reason I ask is that I hope that once we get your pain under control, that you'll be able to sleep better and hopefully be able to eat and feel a lot better. Sometimes when we're starting you on medications and we're not quite sure what you're going to need, sometimes the medications can make some people sleepy, especially in the first day or two when we're adjusting things. And I wondered, for you, if we had to make a choice between getting your pain to a 0 and maybe having you be a little bit sleepy versus having a little bit of pain but be more alert. If we had to make that choice, which I hope we don't, what would you prefer?
I would really like to I would like to manage the pain, yes. My ultimate goal, no pain.
Okay.
But on the other side of it, I'd rather be clearer of mind and maybe my pain down to maybe a 3.
Okay.
I want to be able to talk to my son, Charlie.
Oh, okay. How old's your son?
12.
12, all right.
And he'll be in later on this afternoon if you want to meet him.
Yeah, absolutely.
And I just miss being with him. And if I just had a little bit of pain, I think I could deal with that.
Okay.
So I could be clear of mind.
So you're the only one at home with Charlie?
Yes.
Okay, yeah. So
But I have my best friend, Sandy.
Okay.
She's my next door neighbor. She is like a second mom to Charlie.
Okay. Well,
and she helps out a lot.
Good. So she's can help with meals and groceries.
Oh yeah,
and
she
checking in
will.
on you. Good.
She's going to pick Charlie up after school today.
Okay. Good. I also wondered about your home situation. You live in a house?
Yes.
Okay. Do you have any concerns about having pain medications like morphine or Percocet or those sorts of things in your home?
No, not really.
Okay.
Charlie understands medications. He has some medications of his own that he takes, and he knows the difference between his and mine. And I feel very safe with having anything around the house.
Okay, good. Because what I envision us doing for your pain management is to put you on a stronger pain medication like morphine. That's what you'll need to control this type of cancer pain. And we'll try to get it adjusted so that your pain is as low as it can be. But that you're also able to take care of your son and take care of the things that you need to do around the house. So does that sound like a good goal, and maybe a 3 or maybe less for your pain management? Okay. Anything else that you want to tell me about your pain or about what's going on?
No, I think we talked about everything. Can I ask you a question?
Sure.
I know the cancer is in my bones. I know that, but the other doctor, the cancer doctor, they talked to me about this trial of going on. I can't remember what exactly the name of it, but it was some trial to, I guess, relieve the pain, or I'm not really sure what that's for. But They, I don't know how to phrase this, so forgive me if I'm kind of all over the place with this. I guess what I would really like to know is how much time do I have left? They talked about this trial and said maybe I would have 3 to 6 months, and I guess I'm just confused about that.
Okay.
I don't know how to think about that because I have to make plans. As much as I really would like to put that off, I know I have to do it.
Sure, absolutely.
And I've got a son to think about. He has some special needs.
Okay.
And I owe him that.
So your oncologist has told you that your cancer has spread to your bones and that you may be eligible for a clinical trial.
A clinical trial, that's
Okay.
what it was.
And that's that would be a special type of treatment. You may receive the treatment or you may not, and that's something that that the oncologist could discuss with you in greater detail.
Okay.
I have spoken to your oncologist about about what to expect, and I wonder what exactly you wanted to know. It sounds like you want to know sort of a time frame, and that
I do.
Okay. Yeah.
I have to know.
Yeah.
I have to know.
Sure. And sometimes this news can be upsetting, and so I wonder if it's okay for you to hear it by yourself, like you are now. Is that
I know.
okay?
I know somebody should be here. Sandy can't be here with me right now.
Okay.
But I've been through the cancer part before with my breast cancer.
Right.
I know that the talk is tough, and I had a different kind of survival rate
When you were
when I
initially
had
diagnosed.
right. Things have changed. I understand that part now. I just want to know, I guess,
Yeah.
exactly what it is that I have to look forward to,
Right.
not only for myself, but mostly for Charlie. And I'm going to have to make some plans, and Sandy will help me with that.
Okay.
I would really like it if you could tell me now.
Yeah. Well, and I think that what your oncologist told you is what he had discussed with me as well, and that is that with or without or with the clinical trial, there's a possibility that you may live up to around 6 months. Of course, everybody responds differently to treatments, and so it may be less than that, and we may be talking more like a few months or maybe 1 or 2 months, something like that. It could be as short as that, and I think that if you're going to make plans, then it would be important for you to keep that entire frame in mind, entire time frame. Does that surprise you, or
No,
yeah.
not really. I always thought about it. I guess I had it in the back of my mind that this is a different trip.
Yeah.
This is a different trip to the hospital, and I needed to hear it from someone else.
Okay.
I really, it helps me figure out what I'm going to say to Charlie, to my friend Sandy, to Charlie's father. I know people talk about this as like this is part of a life experience, and that's the experience I guess that's going to be for me. As much as I might not like it or don't want it, that's what's going to happen. Once I collect myself and I talk to my friend Sandy, would you be available to talk to both of us again so that she understands what else is going on?
Absolutely. And you have a lot of big decisions that you're facing, and I know you have a lot of things to think about. And just so you know, I'm not only here to help with your pain and your other symptoms, but I also work with a team, and we can help you as you face, making these plans, and having to figure out what you can do to make sure Charlie's well cared for, and how we can maximize your quality of life for whatever time that is that we have left, and whatever you decide. We'll support you in every way that we can. So what I'd like to do is get started on getting your pain under control. And I'm going to go get the nurse and see if we can get a dose of morphine given to you, of IV morphine. And then I'll be back in the afternoon. You can just have the nurse page me when you're ready to talk, and then we can see how your pain regimen's working, and also talk about anything else that, any other questions you might have. Okay.
Thank you so much,
nice
for talking to me in such a straight way. I really appreciate that.
It's my pleasure.
Thank you.
You're welcome.